Hello and greetings from Mater Dei Hospital in Malta. I'm Natasha Muscat and I'm here today with two of our nurses, Rachel and Jorgen.
I'm a nurse working at the infectious diseases unit for the past 7 years. Mainly the COVID experience has been a challenge where we saw a lot of patients suffering from the coronavirus. Patients that are away from their families for a long period of time due to their recovery. And basically our main aim as a ward, we try to make a better experience for these patients in order for them to get better and feel more welcome and at home in our ward.
My name is Jorgen Souness. Currently I'm taking care of the vaccination rollout along with my team. We take care of ordering vaccines, planning appointments, sending appointments to clients. This needs a lot of preparation. I mean that we need planning beforehand. We need to order vaccines from CPSU. CPSU have to have these vaccines in stock so that they can supply us and supply our clinics. We need to order and book nurses accordingly so that they can help us vaccinate. And as well as the registration team so that when they come, they find the whole setup. We started with the immunosuppressed persons. We continue to the over 70 years old clients. And then healthcare workers and educators followed, continuing going down by age according to their ages. To capture those people that literally are still hesitant to take the vaccine is quite a challenging job for us. The thing is, we want them vaccinated, not just to reach the 100% vaccinated population. We want to capture these clients, these hesitant people, just for their own health, for their own sake. Currently, as you know, we're having deaths everywhere in the world due to COVID. So to protect children, to protect the vulnerable, and especially the immunosuppressed, everyone needs to take the vaccine. My job is try to explain to them the benefits versus the risk of the vaccines. And obviously, the benefits, they always are much higher than the risk, because mostly these clients, they have fear of the unknown. They are exposed to social media data that is not correct. So what happens is they be afraid to take the vaccine. So I try to overcome their fear, and by explaining to them step by step what the vaccine consists of, what they might experience, side effects that everyone might experience some side effects.
The most challenging moments were when these patients weren't getting any better, basically, and we saw them deteriorate day by day. And at times we did everything we could, but still they were deteriorating. And at one point the situation was getting out of hand. We were having a lot of admissions, and the work was getting hectic every day. Patients being transferred to more acute care, intensive care. That was a challenge. It's very tiring, especially the mask. The mask has to have a tight fit so that we're safe and covered. And basically, it's even about our emotions. Like when we have normal patients, we can express ourselves, we can smile, the patients can see us laugh and everything. With the personal protective equipment, the patient will just see our eyes. So no emotions, he cannot recognize that this is this particular nurse who came to help me this morning. And it's very tiring, basically, and obviously we had to exchange between us and have breaks in between. You cannot stay a whole day with personal protective equipment because it's very hard.
If I had to ask you to pass on a message to perhaps some young people who may be considering a career in nursing but are not sure, what would your message to them be?
My message obviously would be that nursing is not an easy profession, but at the end of the day, after a shift, you go home and you say, I've made a change in people's lives. I have helped people. I'm offering a service also to my country because we're on the battlefront of this pandemic. It's very rewarding and very satisfying at the end of the day. What has kept me going? I think my colleagues, our teamwork got better with COVID-19. support from all the multidisciplinary team, the doctors, the physios, the carers, the cleaners, everyone. And also my family, my relatives. I mean, this wasn't easy for them. They were also afraid that I would get COVID or, you know.
By the end of the day, when you go home, you can say that you save life. Saving lives in this modern world and this modern, medical world is really job satisfying. Healthcare workers face a lot of difficulties especially during this pandemic, but when you feel recognized, when you feel respected by the community, especially when we are seeing them coming for the vaccines, they are believing in science, they are believing in us, that's quite really rewarding for our profession.